What happens when people are returning month after month to talk about pediatric behavioral health, to come to the echoes? What happens is you find out who's in the neighborhood, who else is out there like-minded, working on the same types of problems, dealing with the same workload. What you find is mentors, you find validation, you find belonging. You just find a network of where to go when the situations are critical.
There's always new people joining, and so I think that's important because it gives us the opportunity to connect with, other primary care providers in the community. And then, also another thing I've noticed is they share a lot amongst each other now.
And so we've built this connection throughout the state, from people from way up north, down east, down to Portland, and beyond. So it's been a great way to connect all of the people who serve our young people in Maine.
And they're feeling, even though it's virtually, like they have a network of peers around them, and that support and resiliency.
It's also been so wonderful seeing that I'm not the only one struggling with what to do in scenarios that just seem sort of hopeless, that we're all going through this together, so you don't feel as isolated.
So it's not just me sort of standing on a limb, and I feel like I have a whole team of support that I can call on at any time.
I think I'm really proud of the community that has developed over time with this program, the support that the professionals engaged can give one another through the education programming, through the consultations. The providers, I think, have been able to call upon one another. They've been able to know that they're supported.
I know I have a network that I can lean on.
That we're all going through this together.
They know who to go to if they do need more answers or more information.
To be able to treat kids where they're at.
And even if they know what they're doing, they can reach out to me and I can say, yes, you're doing exactly what you should, or I can give them some tweaks about things that they can do differently.
I really have seen an increase in confidence in the providers.
I feel like I have a whole team of support that I can call on at any time.
I have several of the pediatricians now just on my cell phone. We can, connect directly.
It has opened up lines of communication that may not have been there before, and it's developed relationships with people that may not have had the opportunity to interact.
But I think that's really where the meat of this program lies, is in the relationships we've built and the kind of trust we have with each other about being able to manage things together.